President Trump was discharged from Walter Reed Hospital after just 3 nights of treatment for COVID-19. With round-the-clock care in a private suite, access to experimental drugs, and a round-trip helicopter ride, the president enjoyed comfort and attention that money can't buy. Or can it? As a world leader, the president has access to a world-class medical team.
You have more doctors than you thought existed in the world? I was surrounded with like 14 of them.
Care that, by the way, he doesn't pay for.
You're going to get the same medicine, you're going to get it free, no charge. And we're going to get it to you soon.
But what if the president, like one of the 30 million uninsured Americans, had to cover the costs of the treatment he received out of pocket? We've spoken with experts and done the math. Here are the real numbers of President Trump's COVID treatment. So how much is Trump's coronavirus care likely to have cost? We started by asking Dr. Bruce Lee, whose team at the City University of New York created computer models to calculate the cost of care on the American healthcare system. That includes treatment for COVID-19.
We came up with hundreds of billions of dollars. If someone has a mild case, it's not going to be as expensive. But when you start requiring hospitalization, the average or the median costs can be around like $14,000.
But for Trump, on the other hand,
probably at the very least in the multiple hundreds of thousands. And I would guess probably, it could very well be well over that.
So let's break it down. Over the course of the pandemic, President Trump has been eager to throw his support behind a variety of therapies.
President Trump in May said he was taking hydroxychloroquine to prevent infection, although there is no clinical evidence of high quality that shows it works in that way.
In July, Trump and his press secretary offered conflicting views on how often he's tested. But assuming Trump has received at least one rapid test each week since early March, let's assume he took 35 tests at an average of $200 each. On October 1st, when Trump tested positive for the coronavirus, he immediately received what's known as a monoclonal antibody treatment from a company named Regeneron.
So Regeneron's antibody cocktail is still an experimental drug, so only about 10 people have received it outside of those clinical trials, President Trump being one of them. It's also incredibly expensive to produce. It's a complex manufacturing process for a biologic medicine.
Regeneron's drug is not yet on the market, so the price for it hasn't been set. But on average, these treatments, which can also be used to treat cancer, can cost around $100,000.
I don't know what it was. Antibodies.
Trump received a supersized dose, quadruple the amount used in trials, according to a statement from the company. At Walter Reed, the president was treated in Ward 71, a special VIP wing reserved for heads of state and their relatives. Ward 71 has its own office, conference room, and dining room with a chandelier. The exact cost to run Ward 71 each day is unknown, but VIP suites in other top hospitals with much more modest accommodations charge up to $4,000 per night. While at Walter Reed, the president likely received several diagnostic tests, like a CAT scan or chest x-ray to check for pneumonia. While there, he received supplemental oxygen at least twice and started a 5-day course of remdesivir.
Even though remdesivir has shown a modest effect in treating COVID-19, it has been in short supply for several months just due to the manufacturing challenges and the incredible demand for the drug.
He also received dexamethasone, a steroid usually only prescribed to patients with signs of pneumonia. This was probably the cheapest therapy the president received.
This combination has not been tried in wide numbers of people. It's possible that no one has received all 3 drugs at the same time besides the president.
But what about how the president got to the hospital? On October 2nd, Trump flew in Marine One to Walter Reed Medical Center, 8.5 miles away from the White House.
Air ambulances are some of the biggest costs to everyday people that you can incur in the healthcare system, because a lot of them just don't participate in networks for insurance companies.
The median charge for an air ambulance was around $39,000 in 2016. Assuming at least 3 helicopters flew in formation both to and from Walter Reed, that's $234,000 for under 15 minutes of flight time. And that brings our estimate for the total cost of President Trump's COVID treatment to nearly $650,000. But the final cost of President Trump's illness extends beyond his own infection. Over 30 people tested positive for the coronavirus after the same Rose Garden event where the president likely contracted the disease. And just how much it will cost to treat all of them is still unknown.
the costs don't stop right at the infection. There are people with persistent symptoms. They may have lung damage, or they may have organ damage, or they may have other problems that persist. That's added costs. It's not like people return to their normal lives after getting infected. Many times they're continuing to suffer problems. A lot of that could have been prevented.
The president is back in the Oval Office and out on the campaign trail. And when it comes to the cost of the pandemic, he has his own idea of who should foot the bill.
China will pay a big price for what they did to the world and to us. But we have medicines right now, and I call them a cure.